Welcome everyone to the Center for Autism and Neurodevelopmental Disorders Success in Special Education series. Today we're going to be talking about the basics. My name is Jeanne Anne Carriere. I'm an educational psychologist at the center, and I'm also the director of FAST, which stands for Families, Agencies, and Schools Together. FAST's goal is to work with families and school districts and also community providers to help families better understand special education so that they can navigate through this system successfully and feel like they understand it and they're really able to support their child. So today we are going to cover just the general who, what, when, where, and how of special education. And in the end, what we're going to do is really try to highlight some things you can do as a parent to be more actively and meaningfully involved in this process. And so we're going to start out with what is special education? A lot of people, when they think about special education, think of it as a place that we send children if they need extra help. But special education is actually not a place. It is a federally mandated group of services. Those services are actually designed to support children who have an eligible disability by providing them special education services and support so that they can access and make progress toward the regular education curriculum. It is, as I said, a federal law. Those services are provided within the public school system because it is a federally mandated law. And the services a child gets are based on their educational needs, not their specific eligibility. We'll talk a little bit about that later. And so sometimes people wonder, where does this law come from and why do services sometimes look different depending if my child's in a local district or we move from a different state? Well, the overarching law that we follow is the federal law, which is called Individuals with Disabilities Education Act. Oftentimes you'll hear it referred to as IDEA. IDEA tells states what they have to do, and the Code of Federal Regulations explains how we're going to do that. Now, in our country, we really appreciate and respect state rights. And so each individual state also gets to create their own special education code or law, though it has to follow IDEA. So states can offer more than IDEA says they have to. They cannot actually offer less. And so in California, we follow the California Education Code and California Code of Regulations. Now, there are not going to be drastic differences because we all follow federal guidelines. So if you move from Florida or Maine, or if you're in California, you're going to move to Colorado or Alaska, your services and the laws you follow are going to look very, very similar. So oftentimes people wonder, if the law is so similar federally and state to state, why does it sometimes look different when we get down to a local level, like in the school district that your kids are in right now? Well, there's a couple reasons for that. The law and how it's interpreted can vary. It would be really great if it was just simple and black and white, but there is a lot of gray in how school districts interpret what the law says. But then there's also this idea of professional judgment. And so just like if you had a medical concern and you went to a few different doctors and they maybe had the same general idea of what was wrong, but wanted to treat it in different ways, school districts work in similar ways. So I was a school psychologist for many years in the public schools. And so although I may have clearly identified the same concerns as someone else did, the same strengths and challenges, I may have recommended that we go about providing services slightly differently. And so that sometimes is challenging for parents, but when we sort of reframe it and think about it as professional judgment, it makes a little bit more sense for us. And then who gets special education? Well, this again is not the most simplistic concept. And so children ages 3 until they turn 22, so from their 3rd birthday until they turn 22, are eligible for special education services. There are 2 parts to the criteria. And so the first part is that a student must meet one of these 13 eligibility categories. And I want to emphasize that these are eligibility categories. They are not diagnostic categories, or these are not diagnoses. And so you might look at some of these and think, well, we're using the same terminology as we would use if they went to a medical or clinical provider and were given a diagnosis. And we understand that that's confusing, but school districts, at least in California, we do not diagnose when we are doing an evaluation for special education. We're actually looking to see if the child meets educational eligibility. And so there are 13 of these eligibility categories. Some of them are quite broad. For example, other health impairment covers quite a few different health impairments that might be impacting a child's educational performance. So not only does the child have to meet one of these eligibility categories, the disability or need that they have that makes them eligible has to be of the severity that they require special education support and services to benefit from their education. And so there are those two pieces to the criteria. Although children are eligible between the ages of 3 and 22, not all children will receive services. Sometimes children aren't found eligible until they're older because they hadn't started school, or parents were not aware, or the school was not aware that a child had a need. And then once a child receives a high school diploma, typically when they're between 17 and 19 years old, they are no longer eligible for special education. Typically in California, children that are going to maintain their IEP and have services through their 22nd birthday are going to be what we call on a certificate of completion track, where they have completed their 4 years of a traditional high school, but then are then going into a adult transition program where they're working more on life skills, independent skills, adaptive skills, things like that. And so what does special education provide? Well, in special education, we like acronyms. And so you will oftentimes hear this acronym called FAPE, Free and Appropriate Public Education. And so we're going to break down each part of FAPE. So free means free. If a child's eligible for special education and the IEP team believes that a child needs a service, then those services are going to be provided at no cost to the family or the parent. And those services can be very broad. So for example, it might be specialized academic intervention. It might be counseling services or mental health support. It might be behavioral services, could be speech and language therapy, occupational therapy, adaptive PE, transportation. It can go on and on. There's lots of services that children with disabilities have available to them. Now, it is not though like a parent's going shopping and they get to walk through and say, I'll get a little bit of this and a little bit of that. The appropriate piece comes next. And so what appropriate means is that the services that are provided need to be directly linked to a child's unique educational needs. So it doesn't mean that every single child will get every single service, or that every single child is eligible or even needs a service. What it means is that the IEP is tasked with looking at what this child's unique needs are, and then designing a program or creating a program that's designed for the child to make progress in their educational setting. And we'll talk a little bit more about how they do that in a second. And then the public education piece is pretty simple. It means that for a child to receive these services, they have to be enrolled in public school. Parents who choose to enroll their child in a private school or parochial school have the right to have their child evaluated for special education. And then the school can say, you know, we recommend your child get these services. Here's our offer of FAPE, or an offer of free and appropriate public education. Then it's up to the parent to enroll that child in the public schools for them to continue to get those services or to start those services. Now, how does the school provide FAPE? And so that is done through an individualized education program or plan, typically just called an IEP. And so the way that they offer FAPE is that they design and implement this individualized education program. The IEP is really a blueprint for the child's special education services. It will describe their strengths, their weaknesses, their specific needs, their goals, the services and supports they're going to get. I do want to emphasize that the IEP is specifically designed to address those unique educational needs. It is not the only part of a child's public school education. So if a child has skills that are, within a grade level range, let's say, then that is not going to be included in their IEP, or maybe not a grade level, even developmentally appropriate range. That is not going to be in their IEP. Those are skills that would be addressed through general education. And so sometimes that's a little bit confusing for families, but for a skill, a need, or a goal to address that need, for that to be included in the IEP, it has to be a unique need for that child. IEPs are individualized because they are designed for that child's unique educational needs. IEPs, the services you get, the goals you get, are not dictated by the child's eligibility, their specific eligibility, for example, other health impaired, specific learning disabilities, speech and language impairment, autism. They are designed based on their unique educational needs. That's why it's called an individualized education program. And so where does special education take place? Where do children get these services? And so, as I said in the beginning of the video, sometimes people think of special education as a place that we send children who need extra support, but special education is not a place. And so children typically receive these services, well, I should say they always receive these services in the least restrictive environment. I think what sometimes shocks parents is that the majority of children who receive special education support, their placement is in a general education classroom, so a regular classroom, and then they get this additional support either by having someone pull them out for part of the day or push into their classroom to provide their services inside their classroom. The idea of least restrictive environment is very, very important. And it basically says that children who have a disability need to be educated with children who do not have disabilities to the maximum extent possible. And so school districts are not going to look at a more restrictive placement, and more restrictive meaning less opportunity to interact with kids who do not have disabilities, unless there is evidence to show that using accommodations, modifications, and services that the child's needs cannot be achieved or their goals cannot be achieved. Schools will also try to educate children in their home school, which is typically the school closest to their house, unless the child needs a specialized program and that program is not available at their home school. To meet this concept of least restrictive environment, school districts have to offer what we call a continuum of placement. And so that means that we have general education placements, and a child very well could be placed in their regular classroom, and then perhaps they have a specialized supporter service. Somebody perhaps works with them in a small group in the back of their classroom on reading for 30 minutes, 3 times a week, or perhaps they're pulled out to do that same group. They might be in a general education classroom and leave the classroom to go to a speech group or to an adaptive PE class. Or it could be that if they're working on some type of social skill, the speech language therapist would push into the classroom and work directly with a small group there. And so that would be general education with support. When children need more support, and typically we would say specialized academic instruction for more than half their day, sometimes school districts will start looking at what we would call a special day class. Those are typically self-contained classrooms with a special education teacher. They have additional adult support, and children are grouped by they can be grouped by grades. And so it's usually a multi-graded classroom, not just a one-graded classroom. And so it might be a 1st through 3rd grade. It might be just a 3rd through 5th grade. It might just be a 4th and 5th grade, depending on the class. There are special day classes that are designed specifically for certain types of needs. So we have maybe an autism specific or ABA focused classroom. We might have a classroom that is designed for kids who have significant emotional behavioral needs. We also have classrooms that are more non-categorical. So they might be called a mild to moderate need classroom or a moderate to severe need classroom. And so there's a variety of different types of special day classrooms. We also have, our school districts also have collaborative classrooms, which are a really great option. Typically, we don't see these until middle or high school, but in a collaborative classroom, you have 2 teachers, typically a general education teacher and a special education teacher, and you have general education students who need additional support, as well as special education students who need additional support. And so they are co-taught together in what we call a collaborative or collab classroom. Least restrictive environment does not mean that a child is in one place the entire day. So for example, if a child is in a special day class, they can absolutely have part of their day in the general education environment and part of the day in the special day class environment. Once children get to middle and high school where they start changing classes, they might have some general education classroom, some general education classes and some classes that are in a special ed setting. It just depends. And then there are also much more restrictive environments such as non-public school settings and residential settings. A non-public school setting is not a private school or a parochial school. It is actually a private school that is typically designed for children who have very significant needs based on their disability. And so non-public school settings are sometimes looked at when a school district does not have a program to meet a child's needs. That is an incredibly restrictive placement, because when a child's placed in a non-public school setting, they have no access to typical peers because everyone in that setting has a disability. And so how are these decisions made? How do we talk about whether a child's eligible or what their free and appropriate public education is going to look like? And so there's a system put in place that is very much based on team decision making. And this is called the Individualized Education Program Team, or IEP team. This is a collaborative decision-making team that includes the child's or student's parents and school professionals. This team is very much geared on shared expertise. And so the parent is an expert on their child. No one will know your child better than you do in the home and in the community. And depending if your child's brand new to a school district or has been there for a while, there are school professionals who will know your child very, very well and are expert on how they interact, show what they know, that sort of thing at school. And so this partnership is really geared toward everyone sharing their expertise, sharing different information they have, and then sharing decision-making and sharing implementation of this IEP. I would be remiss in saying that oftentimes parents don't feel like they are part of a decision-making team. This can be an intimidating process, and I don't think that's intentional on the school district's part at all. I think that it just can be intimidating when you're going into a setting where there are a lot of other people who have different knowledge levels than you do about different parts of your child's development, and to listen to them and to feel like what you have to say is equally as important, but it is. In fact, it's vitally important that parents share as much information as they can about their child, because it will really help the team understand your child better and then make just better decisions. So the IEP team includes multiple people. The people here that are bolded are people who have to be there. Parents have to be at an IEP meeting. So does the general education teacher, a special education teacher, and a school representative who is familiar with both general and special education. Oftentimes that's the school administrator. It might be the school psychologist. It might be somebody from outside the school who works for special education. It can be lots of different people. Those 4 people have to be there for it to be an IEP team, unless the parent gives permission for one of them to not be there. So parents can absolutely give permission for a general education teacher to not be present if they don't think that it's important, or for them to leave early in the meeting. Parents can even give permission for the IEP team to meet without them. So other people who could be involved are anyone who conducted an evaluation. So if it's a new IEP, it's an initial IEP, then you're going to have the people there who actually evaluated the child. That might be the school psychologist, could be a school nurse, it might be the speech and language therapist or occupational therapist. It'll all depend on who did evaluations. If your child has an IEP and they're getting services from somebody, for example, they're getting services from the speech and language therapist or an adaptive PE teacher, those people are typically at the IEP as well. The child, if it's appropriate, children should or have to be part of their IEP starting at the age of 16. I actually think it's important to have your child be part of their IEP at a significantly younger age than that, if you believe it's appropriate. It does not mean they will be part of the entire meeting. They might only be there for 5 minutes, but I think it's important for kids to understand that there are people at the school who are working with you as a parent to provide extra support and help for their child. They should know what they're working on and who they're working on and why they're working on this. And I think that can get rid of a lot of anxiety for children. Children know you're having a meeting at the school. They know that there are lots of people involved. And so I think it can really help for them to be there for a few minutes to kind of see what's going on and understand that process. Other individuals who have knowledge or special expertise regarding the child is a very sort of open category. It can be a lot of different people. Parents have a right to bring anyone who they believe will be helpful to the meeting. You should always let whoever the case carrier or the person organizing the meeting is, you should let them know you're bringing somebody. But this can be, it might be a private service provider, like a private ABA supervisor or their speech language therapist, but it also might just be a friend or a partner, or, a spouse, somebody who's there more for the parent. It is absolutely appropriate for you to say, I brought my friend who's known my child their whole life, and they are going to take notes so I can just focus and listen. And so that is always an option for a family member or a parent if they are feeling nervous about being there on their own. And so next we're going to go over the special education process sort of step by step. And so typically there is a referral for an evaluation. An assessment plan is created and signed. The child's evaluated. There is a meeting held to discuss that evaluation. If the child's eligible for services, an IEP is going to be written. It's then going to be implemented. There will be progress reports provided, and an IEP will be regularly reviewed. So we're going to go through each step. And so this first part is referral for evaluation. And so basically 2 people can request or refer a child for a special education evaluation. That is either the parent or a school professional. If parents are going to request, then it is always best for them to put that in writing. And I say that not because they should put that in writing, because at schools, when it's in writing, it's much easier to account for that request and sort of track that request. As a practicing school psychologist for a long time, if a parent would have walked by me in the hallway and said, hi, I want you to evaluate my child, that technically counts as a request. But in the next 5 minutes, there could have been an emergency or something else happened, and then I've forgotten it. And so just to make it easier for everyone, it is just much easier to put it in writing. And that way there is a way to track when you wrote it, when the school district got the request, and when they responded, and it makes it easier for everyone involved. If the school requests to conduct an evaluation, then you have to give your permission first. So parents have to consent to that. School districts cannot evaluate your child without your permission. Some parents may think that they actually didn't request, that their child got regional center services, and then at the age of 3, they were referred to the school district. Technically, that was considered your request. Regional center just helped you into that process, or helped you with that referral process. And so here's just an example of a very basic letter requesting a special education evaluation. I put this in here because I really want to emphasize this does not have to be anything fancy. You basically have to identify who you are, who your child is, where they go to school, what your concerns are, and that you are requesting an evaluation to see if they're eligible for special education services. It's really that simple. It can be written in English. It can also be written in whatever your first language is. It does not matter. It can be typed. It can be handwritten. It can also be emailed. And so those are all considered legal ways for a parent to request. So then what happens? And so once the school district has, or the school, I should say, has your request for an evaluation, they have 15 days to respond. And so what I need to cover really quickly, I'm going to go back a step, is to say that parents have a right to request an initial evaluation, but parents also have the right to request an additional evaluation, meaning if their child is eligible for services and has an IEP, but then you have very significant concerns about like increased anxiety or their fine motor skills and their writing, you can ask that additional evaluation be done. For example, an evaluation of their social emotional skills and whether they may need counseling. You can ask for an evaluation for occupational therapy, things like that. So it doesn't have to just be an initial evaluation. Once the school district or school has your request, they have 15 calendar days to respond, not business days, but calendar days. And so that is actually a pretty quick turnaround. And they have a few different ways they can respond. One, they can send home an assessment plan. So they can fill that out and send it home for you to sign. 2, they can send home a notice saying that they do not believe that it is an appropriate referral. And with that, they will send home your parent procedural safeguards, letting you know how you can disagree with that decision and how you move forward. What I think is the best way for a school district or school to handle it is, instead of just automatically sending home an assessment plan, is that they would meet with you to review your concerns. And so this meeting doesn't have to be in person. It can be on the phone. It can be over Zoom or video. But what that meeting would allow is for you to make sure you have very clearly explained what your concerns are, because assessments are not all created equal. We do not assess the exact same way for every single child. They are individualized. And so we want to make sure that when we go in to do an evaluation, we understand what the parent is requesting and what the concerns are, so that we make sure we're evaluating in all areas of suspected disability and all areas of related need. So what that means is, for example, if you think your child may be eligible for services because they have a diagnosis of autism, then the school district will most likely evaluate their cognitive ability, their speech and language skills, their educational performance, how they're doing in school. They may look at their social emotional skills, adaptive behavior, things like that. But if you also share that I think my child has a very significant reading delay and that they're very, very anxious, then that is going to broaden that evaluation. We might need to be looking for other things as well, okay? When you hold that meeting, a few things can happen. One, you can create an assessment plan together, knowing that you have made it clear what your concerns are. At that time, parents might choose to cancel the request. They may meet with the school and then find out there's like an intervention program that they think sounds really great, and they would like to have their child participate in that before they move on with this evaluation. And the school district, again, has that ability to deny the request, but then provide that parent, the parent procedural safeguards so that they know how to disagree with the decision. So step 2 is an assessment plan is created and signed. And so you should, as a parent, be involved in creating that assessment plan by sharing what your concerns are. The assessment plan is going to list the areas or the domains to be assessed, who will do that assessment, and the types of tools that will be used. So what that might look like is that the assessment plan will have domains of evaluation like cognitive ability, social and emotional skills, adaptive behavior. If it's an area of concern that's going to be evaluated, it will be checked. The person who's going to do it will be written next to it. Now, not the actual name of the person, the title of the person. So for example, the school psychologist, speech and language therapist, school nurse, special education teacher, things like that. And then there will be a list of the types of tools that could be used. It will not be the exact tools that will be used because school districts have the right to choose the tools that they think are the most appropriate for that evaluation. The parent needs to sign this assessment plan before it can be started. Okay, so if you get an assessment plan and you have questions or concerns, I highly recommend you reach out and ask. Assessment plans can be modified or changed, but it's just significantly easier to make those changes before it is actually signed. And then once it's signed, you need to make sure you get it back to the school. So once the school receives this signed document, that is when a 60-day timeline starts. And that 60 days is, again, 60 calendar days. And within 60 days of the day that the school district got the signed assessment plan back, the school district has to conduct their evaluation and hold a meeting with you to review that, okay? So once an assessment plan has been created and is signed, then an evaluation is conducted. And we call these multidisciplinary evaluations or psychoeducational evaluations. Oftentimes they're multidisciplinary because there's more than one discipline involved. And so for example, it might have school psychology involved doing a psychoeducational evaluation, but there also might be speech and language and things like that. So the purpose of this evaluation, again, is not diagnosis. The purpose of this evaluation is to answer the question, does this child have a disability that requires special education and related services? And so they are going to collect data that's going to help them identify whether a child meets an eligibility criteria for one of the eligibility categories, help identify what their strengths are, what their challenges are, and what their educational needs are, and then give that information to the IEP team so that they can make good decisions. And again, you are part, as the parent, you are part of that IEP team. If you do disagree with an evaluation, a parent does have a right to request an independent educational evaluation. And I should say, it's not if a parent just doesn't like the outcome. It might be that if a parent has concerns about the evaluation, they didn't think it was done comprehensively, they have concerns about how it was conducted, there's concerns about the final conclusions based on the information in there. Parents do have a right to request that an independent educational evaluation be conducted. Those are called IEEs. Oftentimes the school district will work with you if you request an IEE to see if there's other areas of evaluation that they can, that the other assessment areas that they can do to sort of help figure out the problem or the concerns that came with the IEE request in the first place. And so who might be involved in a school-based multidisciplinary evaluation? And so there's a list here. These are examples only, and it's going to vary depending on the assessment plan. So not all these people will be involved. They might be involved if there's areas of concern there, but only if there's an area of concern. So typically in an initial multidisciplinary evaluation, so this is the initial time we're looking to see if a child's eligible for services, there will be a school psychologist involved, the school nurse, a special education teacher and a general education teacher. And then it would grow from there. If there's speech and language concerns, then there might be a speech and language therapist. If there are fine motor, gross motor concerns, or sensory concerns, or attention concerns, then an OT or occupational therapist might be involved. And so those core people are typically always involved, but as the concerns widen, there might be other people involved as well. And then what areas can be assessed? And so again, these are only examples and are going to vary depending on the area of concern. But when we say that we're going to look at cognitive ability, it doesn't mean that we're just going to provide a score based on an IQ test. Typically what that means is that we're going to look at a child's intellectual functioning, but we're also going to look at their information processing. We're going to look at their executive functioning, things like that. How do they organize, plan, decision make, problem solves, that sort of thing. If we're looking at academic achievement, we're not going to just look straight at grades. We're going to want to look at process and things in reading, like can they decode words? Can they fluently read? Do they understand what they've read? And so again, this is part of why it's important for you to be part of that assessment planning, because you want to make sure that you have made it clear what you have concerns in, so that you know that these areas are being evaluated. And so I oftentimes hear, my pediatrician diagnosed my child with autism. Are they eligible for special education? And the answer is maybe or possibly. And so I want to differentiate these two different types of evaluations. And I think this can be confusing for families because we call them evaluations, both sides, but they have very different purposes and outcomes. And so for special education eligibility, the evaluation purpose is specifically to determine eligibility and a need for these services. Okay? We identify these educationally relevant concerns, and we use IDEA eligibility criteria. So remember back when we were talking about the law, IDEA and the California Ed Code actually provide definitions of all of those eligibility categories. Some of them have specific criteria. And so that is what is used to make those decisions. When you are having a clinical or medical evaluation done, the evaluation purpose is very different. In that case, you are specifically looking for a diagnosis. And then that diagnosis is needed so that we can really develop a treatment plan that focuses on home, community, and possibly educational environment. In clinical and medical settings, we do not use IDEA eligibility criteria. We use the DSM-5 criteria. And we are looking to see if your child meets specific diagnostic criteria. And so those two evaluations are very, very different. I think it's easy for us to try to make them like they're the same, but I think that just causes confusion down the road. And so a medical or clinical diagnosis based on DSM-5 is relevant. And by law, school districts have to consider outside evaluations. So as part of that assessment plan, I would absolutely say I would like to include the information from this evaluation, but it is not sufficient to qualify a child for special education. And the reason it's not sufficient is because the information gathered in a clinical and medical diagnosis is not going to answer the specific evaluation purposes that we have for special education eligibility. And so to put it in sort of a different graphic, we're going to look down at the clinical medical systems first, because this is an issue that pops up a lot with families. This idea that they have a diagnosis that may or may not match their special education eligibility. And so in the clinical or medical system, it's called the medical model, and we're all very comfortable with it. We live it, we understand it. And that basically means when I go to a doctor with any kind of a medical concern, they're going to do an evaluation of some sort. They're going to diagnose something, and that diagnosis is going to guide my treatment. So that, for example, if I take my daughter in to her pediatrician and say, she's got a very high fever, she's complaining of a very sore throat, and when I looked at the back of her throat, it seems kind of white and gross. So the doctor may say, okay, I'm going to do an evaluation, and that may entail taking her temperature, asking her some questions, looking in the back of her throat, and then giving her a strep test. That is the evaluation. Based on the results of the strep test, she has strep throat. So the diagnosis is strep throat. That diagnosis 100% guides the treatment. Because you have strep throat, your treatment is going to be this antibiotic. In a medical and clinical setting, it works the same way with behaviorally based or behaviorally diagnosed disorders, for example, autism or ADHD. There is no biomarker, there's no test. So when you come into our center and say, I have concerns for ADHD or concerns with autism, that evaluation may include a developmental history, observations, interviews with you. Maybe some testing is done, but based on the data that's gathered, a diagnosis is made. And if that diagnosis is autism, then 99.9% of the time, that diagnosis is going to guide treatment, and that treatment is going to be ABA and probably speech and language therapy. Okay, there might be other things as well, but those are the two that are core. And then what will happen is that you're referred out to get an ABA evaluation, a speech and language evaluation. And then those providers will say, yes, we think your child needs this, and here's our recommended treatment plan. That is the medical model. Parents understand it. I understand it. It makes sense to us. School districts do not work that way. In a school system or educational system, step one is an evaluation is conducted. And as we said, that evaluation is a very different purpose. The evaluation is looking for eligibility. And so based on the data in that evaluation, the team decides eligibility. Is this child eligible? Now, it doesn't matter so much what the eligibility is, just do they meet an eligibility? If the answer to that is yes, then that team goes back, looks at those evaluation results again, and identifies the child's educational needs. In an educational setting, your eligibility does not dictate what you get, your treatment, your intervention, your IEP. Your educational needs do. That is the absolute most important part of the IEP, because those educational needs drive what goals will be made. And then once the goals are made, then what services and accommodations are going to be offered. And then once that is done, the placement that's going to be offered. And so that is a very kind of confusing idea for families, that not the eligibility, but your child's needs are going to sort of drive what's in their IEP. So for example, we might have 5 children who have an eligibility of autism, okay? But if they have very different educational needs, their IEPs are going to look very different from each other, even though they have the same eligibility. You might have a child who has an eligibility of speech and language impairment, a child who has an eligibility of specific learning disability, a child has an eligibility of other health impairment. If all of those children have needs in like social communication, social interaction, their IEPs may look very similar because they have the same educational needs, because your eligibility does not dictate what you get. And so it is not uncommon that a child may have a diagnosis of autism, but for whatever reason, they may not meet the eligibility criteria because it is different than DSM-5. They may not meet the eligibility criteria for special education under that category, but they do meet it under a different category. In the big picture, that may not matter, because regardless of what your eligibility is, specific learning disabled, speech language impairment, other health impaired, your needs are what are going to decide what you get. And so really putting energy into figuring out, has this evaluation identified all my educational needs, is a place that I really recommend parents put their energy. And so why do I spend so much time talking about this? Well, because evaluations from different agencies can lead to different services. So a special education evaluation can lead to an eligibility, but it's going to lead to school-based services because school districts and special education are only responsible for providing educationally relevant services. So their services are going to be very geared toward goals that are going to address learning and are going to provide like foundational skills for your child so that they can learn. A medical or clinical evaluation can lead to a diagnosis, and that can lead to private services. And so many of the children that we work with need both. Not only do they need special education services where they can access school-based supports, but they need private services that are going to work more on home and community-based skills. And typically, to access those through insurance, you're going to need a diagnosis. And so step 4, now an IEP meeting is held. Now, at that IEP meeting, we've done our evaluation, we've got this information. Basically, it is reviewed. Now, if it is a initial IEP meeting, we're going to be looking over an evaluation. Or if it's a triennial IEP meeting, we're going to be looking over evaluation data. If it's an annual IEP or a different type of IEP, we may be just looking over current information from the classroom. But we are going to review it, discuss it, and then this team is going to make decisions about all of these factors: eligibility, need, assessment supports, goals, accommodations, services, and placement. And so the goal here is it's not a democracy where majority rules. The goal here is for everyone to have consensus. And so for everyone to agree. That does not mean that everybody gets exactly what they want. It means that we are all in agreement that what we are providing is high quality, it's meeting the child's needs, and that we are okay with it and we can move forward with it. And so it's important to keep that in mind, that everyone's goal here is to provide a high quality program, but it's important to sort of listen to everyone's sort of ideas about why they think something may or may not be needed or is needed. And so that is the point of that IEP meeting, is to have those discussions and make those decisions. And then step 5, the IEP is actually written, and it is written in this order. Oftentimes parents are concerned because when they come to the meeting, they see that there's an IEP already drafted. And so I should say that there's always going to be a draft IEP made available at a meeting. That is because if a team had to start from scratch and start with a blank IEP, you might be there for days. And so the draft is usually just based on a school team's recommendations. Parents need to know that it is marked as a draft and that drafts can be changed. Things can be added, things can be deleted. It truly is a draft until the parent signs off on it. And so it really is sort of a time-saving measure for the school-based team members to have that draft in place. Now, the IEP is written, but also discussed in this order. And so sometimes what happens is if we are running out of time, maybe we had an hour and a half meeting scheduled, and we've spent a lot of time talking about needs or goals, and we have a very short time to talk about services and placements. You have a couple options. One, you can definitely ask that you have a second meeting. But if you know going in that you're going to have questions, you want to talk about placement, you want to talk about services and supports, it might be really beneficial for you to actually say that at the beginning of the meeting, to make sure you have time to do that at the end. Because I think, unfortunately, oftentimes, even parents that are kind of rushed and want to get the meeting finished run out of time to have a really deep conversation about the last pieces of the IEP. So there are key parts of the IEP. I know it can be overwhelming to look at these documents. They can be very, very long, but I've sort of picked out some just important parts that parents should be aware of. The first page is just information. It is demographic information about your child, but it'll also tell you what their eligibility for services are. the second or third page starts with present level of academic achievement and functional performance. And so in this section, they're going to talk about your child's strengths and challenges in academics, communication, motor development, social emotional behavior, vocational skills, adaptive daily living skills, and health. This is also where information from the parent is included, which can be concerns and ideas and that sort of thing. At the end of present levels, there is typically a statement that focuses on educational needs, and that will list the areas of needs for your student. As I've said before, accurately identifying those needs is really important because they're the foundations for the goal, services, and placement. Next section is usually goals, where they're going to have academic and functional skills. Goals are written for what a child can accomplish during a school year. And so they may be broken down into shorter term objectives, but the actual goal should tell you what the baseline is. So what can the child do right now? What the goal is, how they're going to monitor the progress of the goal, and then who is in charge of that goal. What it doesn't tell you is how that goal is going to be addressed. And so that is a question that parents absolutely can ask during the meeting. It's like, what kind of things are you going to do with my child to help them meet this goal? After the goals, there'll be information about accommodations that your child might get within their program, within their classroom, things like that. And then there'll be a section that talks about the actual special education and related services you're going to get. So that's going to say what services they're getting. For example, are they getting specialized academic instruction for a certain amount of minutes every day or every week? And then it will also talk about whether you need services outside of the school year, which we call extended school year. Then after that, there'll be an educational setting where it will talk about the extent to what your child is in special education and to what extent they're in general education. Typically that's given as a percentage. This is very related to the least restrictive environment. And then lastly, your consent. And so the IEP has a signature line where a parent or guardian can officially agree to the plan. Consent is not as simple as just a yes, there's other options. And so before a school district can provide you their IEP, before they can provide you their free and appropriate public education, their offer of FAPE, parents have to give consent. And so parents have multiple consent options. And so one of those is that they sign an agreement. So you are happy with the IEP, the eligibility, the goals, the services, and you would like the school to have permission to get started. And so parents can absolutely sign that they consent to this IEP and it will start as soon as possible. Parents also have an option to sign an agreement to the IEP with the exception of something. And I think this is an underused strategy. So sometimes when parents don't agree with something, they don't agree with the level of service, maybe for speech and language or the goals in a certain area, they let the team know that by refusing to sign the IEP. But typically there are parts of the IEP that the parent is very happy with. And so this option allows for you to agree to the parts of the IEP that you agree with and list the parts of the IEP that you do not agree with. And so what that does is let the school district implement the IEP or the parts of the IEP that you have said okay with or okay to. And then you will likely have another meeting to discuss the parts you do not agree with. So if, for example, you are not happy with the amount of occupational therapy services, you can sign in the agreement to the IEP with the exception of, and then a parent just writes in occupational therapy services, or if it's the goal, you can write occupational therapy goal. It can be as specific or as broad as you'd like it to be, but I do think this is a great option for parents who want to further discuss something they do not agree with. Lastly, parents can sign that they participated so that they attended the meeting, but they do not agree with the IEP or want the services offered. And this has a couple different things. It might be that, you've asked for this evaluation, but you actually don't agree and you do not want your child to receive these services. So parents can say, no, thank you, and we're done. But it also could mean that there's more than one part that you're upset with, and you actually are refusing just to sign the IEP. And so typically what will happen is that that's going to lead to another meeting or possibly due process proceedings. It might be that there's another meeting where somebody else from special education comes in and tries to help sort of mediate the situation, but that is also an option. I will emphasize again that I think that if there are parts of the IEP that a parent likes, I think it is important and probably in your child's best interest to sign for those so that the district can get to work on those. And then step 6, the IEP is actually implemented. Parents are given a copy of the draft or the completed IEP. You should always ask for that. Sometimes you'll get it that day. If it's important for you to leave with that, then you can ask that they print you out one right then and there. Sometimes they'll send home the draft because if they have to make some changes, they'll send it home with your child that day, or they'll email it to you at the end of the day. It's the school's responsibility to make sure the IEP is carried out as soon as possible after parents have given their consent. And they will provide the parts of the IEP that are important for teachers. And so if it's a child in elementary school, it might be important that the teacher has the entire IEP. But maybe a child in high school, if a child has accommodations in general education classrooms, perhaps the teacher doesn't need the entire IEP, they just need the accommodation pages so that they know what they're supposed to be doing or providing that child. Then step 7, progress reports are provided. And so, as I said earlier, the goals are written for a year. What do we think this child will accomplish in a year? Well, parents should not have to wait for a year to find out if their child's making progress toward their goals. And so progress reports let parents know if their child's progressing and on track to meet that goal. Typically, they're sent home every few months. The law says they have to be sent home at least as often as parents are informed of their non-disabled child's progress, which is usually report card time. And so what that means is that typically around the time that your child gets a report card, they'll also be getting a progress report. They may not come home in the same envelope. They may not come home on the same day, but within that, time period, you should be getting that. If you didn't get it, it is absolutely appropriate for a parent to reach out and ask for their progress report so they can know where their child is. If the progress report says that the child is not on track to meet their goal, then a meeting should be held to discuss that. It doesn't mean that we need to adjust the goal. We don't need to make the goal easier. Is it that we don't have the right service, the right amount of service? Did something change? And so there should be a discussion to figure out why that child's not making the progress that we initially thought they would when we wrote the goal. And then step 8, IEPs are reviewed and they can be changed. And so IEPs have to be reviewed at least once per year. Those are called annual IEP meetings. Though an IEP meeting can occur more often if parents or the school ask for a meeting. So that can be either the school making that decision or a parent making that decision. If a parent wants a meeting, they can request an IEP meeting. I again recommend they do it in writing, and then one needs to be held within 30 days. I sometimes hear parents say, like, I asked for an emergency IEP meeting. There's actually no such thing as an emergency IEP meeting. School districts always have 30 days to hold an IEP meeting. That said, I have never seen a school district not work very hard to hold an IEP meeting very, very quickly. If something does happen, that means the team has to meet right away. So IEPs can also be revised without having to rewrite the whole IEP. So if there's a meeting called, or there's a concern, something needs to be added or changed, that can be done through what's called an addendum. And there's basically a couple pages that just gets attached to the front of the old IEP. So perhaps your child met all their reading goals in the first 3 months. Well, we're going to add some new reading goals. So that can just be added that way. Maybe we wanted to add some counseling support. And so we're going to have your child be in a group once a week for 30 minutes during lunch. That can just be added through an addendum. At least every 3 years, students receiving special education are reevaluated, and that is called a triennial. And the purpose of that is to evaluate, does this child continue to be eligible, and do they demonstrate a need for services? We also look at whether the program is working, if the child's making overall progress, things like that. But those are called triennials. And those also can be held early if appropriate. Sometimes the school district will ask that it be held early. Sometimes parents will request that. So the last few slides are really talking about or addressing how you can be actively involved and support this process. And so from early on, when an assessment's been requested or we're in the assessment planning process, it's important for parents to share their specific concerns and then read and ask questions about your assessment plan. Make sure all your areas are being addressed. Every concern you have is somehow being addressed. Once you get the assessment plan, sign it and return it, because that's when that 60-day timeline starts. Sometimes parents will keep it for months, but if you've got questions, then reach out to the school and ask about it. During the assessment, I think it's important to share information early. Don't wait until a week before the meeting. So if there are outside assessments or diagnoses that you want them to be aware of, then you need to share those early on. Sign release forms. If you want them to speak to outside school, providers, then go ahead and sign those early on. Oftentimes, if an evaluation is being done, you will get a stack of rating scales to complete. It can be very overwhelming for families. And so I always recommend parents don't do more than one rating scale a night. And if you think your partner or spouse or child's other parent has significantly different ideas or opinions or experiences with your child, it is appropriate to ask that you each fill out the rating scale, that it not just be one parent. But when you're completing those rating scales or checklists or questionnaires, read directions carefully. They are not all the same. And ask questions if you're unclear. No one expects you to be an expert in these areas. And so if you're confused about, what some of the ratings mean, then send an email or pick up the phone and ask. And then try to answer them honestly based on your experience. During an assessment is, try to keep a neutral or positive attitude when talking about the process and or school with your child, because if you are very anxious or nervous or angry, it is very easy for children to pick up on that. And they're typically not going to say, well, my parents really angry at the school. It's much easier for them to say, my parents really angry at school. I go to school. My parents very angry and worried about me. And so try your best to keep a neutral, positive voice or attitude when discussing what's going to happen with your child. And then once an evaluation is done, before that first meeting, I am still a big fan of having a binder or file to organize and keep copies of all paperwork. I know a lot of families have electronic copies of things, and that's a great storage mechanism, but it's hard to refer to an electronic copy really quickly. And so I still recommend families have a big 3-ring binder and they have a hard copy of everything in the binder. If you feel comfortable dragging that to your meetings, I drag it to your meetings, because then you have the ability to reference anything that you want to reference during that actual meeting. Before the meeting, ask about the plan or the format of the IEP meeting. Who's going to be there? What's it going to look like? How is it organized? That's absolutely appropriate for you to ask. It is also appropriate for you to ask for copies of assessment reports to review before the IEP meeting. And so this is sort of an interesting idea, because in the California Education Code, it does not specifically say that parents have a right to have a copy of their children's evaluations before the meeting where it's going to be discussed. I will say that the vast majority of school districts, if you ask for it, will work very, very hard to get you a copy beforehand. It may not be a week or two, it may be the day before, it may be a couple days before, but I still think it's important to ask because it is a lot to do in one meeting. And so what the law does say is that parents have a right to be meaningfully involved in their IEP meeting, decision-making. And personally, I believe it's very challenging to do that if you've never seen this assessment before. You don't know the results, you don't know what they're recommending. I feel like it can become a very overwhelming and sort of anxiety producing experience. And so I would absolutely ask to get copies of the assessment report beforehand. As a practicing school psychologist for many years, that is something I tried to do. There were times when I was not able to do it. And during those times, I would at least try to have a conversation with the parent so there were no surprises. I could let them know what the findings were, what we're going to review, that sort of thing. Before the meeting, write down your questions and thoughts and bring them to the meeting. Do not think that you will be able to sit down that morning and just come up with all your questions. And so I always recommend parents put pad of paper somewhere in the house, a couple different ones. And when questions pop in their head, they write it down immediately because they will pop in your head. And it is just much easier if you're trying to collect all those thoughts for a week rather than the hour before the meeting starts. Bring something to write with and something to write on when you go to an in-person meeting. If you're doing a Zoom meeting, which became very popular in the last year, then have something near you to write on. You will get copies of your parent rights and procedural safeguards. Read them really well. Read them the first time, but then read them probably at least once a year, because even though you read them once initially, things might have not stood out because they weren't important to you at the time. But read and ask questions if you have any questions about them. And then before an annual or a triennial IEP meeting, you're going to do all of the above, but you're also going to want to read and review last year's IEP because you want to know, what was my child doing last year? What are the goals? Because you're going to review those goals at the current IEP. And then take a moment to really look at your child's report cards, work samples, classroom testing. What are they bringing home to give you information about how they're doing? And then you should identify progress you've seen, areas of growth across all areas that the child's getting services in: speech and language, communication, academics, behavior, whatever it is. And then also take the time to, what are your continued concerns and areas of weaknesses or areas that you haven't seen the growth that you'd like to see. And you're going to want to bring that information with you to those meetings. And then during the IEP meeting, how can you be actively involved and support? And so I always encourage parents to give yourself a pep talk and remember you're a vital part of that IEP team. Your opinions, your questions, your concerns and ideas are equally as important as the other members. That said, we have to be really open-minded. Everyone's input is valid. So it's not uncommon for parents to hear things at a meeting, different opinions or information about your kids' strengths and challenges that is different than what you see at home. That's actually not uncommon. School and home have very different expectations, structures, supports. And so it is not uncommon for a child to demonstrate skills at school that they don't demonstrate at home, or vice versa. Demonstrate things at home that they don't demonstrate at school. So be open to that information, and remember everyone's input is valid, but feel free to ask questions about what does it look like. If you are unable to make a decision at the meeting, it is absolutely appropriate for you to take the IEP home to review it. And so those consent options are still the same consent options. You're just asking that you have 24 to 48 hours, whatever it is, to take it home and look at it first. I actually highly recommend that, especially now that a lot of things are done over Zoom. You would have that option anyway over Zoom because they're mailing this document home for you to sign. But if you need extra time to ask for it, take it. If you do agree to parts of the IEP or all of it, you're absolutely fine to sign that you attended the meeting and that you agree to those. And again, do not hesitate to ask questions and seek clarification. And then after this meeting is over, if you didn't sign the IEP at the meeting, sign and return it as soon as possible. If you have serious doubts or concerns, then contact one of the team members to request another meeting or just to ask questions. If you did sign the IEP, it's okay to, when you get home, review it. And if you have questions you don't understand, then ask those questions. I also think it's very, very important to talk to your child about what was talked about at the meeting. Your kids know you were at that meeting, so it's absolutely appropriate to talk about the progress they've made. Talk about their new goals and services. Who are you working with? Like on what days? What is that going to look like? You can even ask your child beforehand questions about what he thinks is helpful and not helpful to share with the team. I just think it's really important to have that open discussion with them. Then continue to work on developing a collaborative relationship with the school team. I can't really emphasize that more. I know this can be an intimidating process, but especially if your child's starting school in a school district that's a K to 12, you're going to be in this district a long time, and it is probably worth your effort to work on a collaborative relationship. That doesn't mean that you tolerate things that you disagree with, or you agree to things that you don't like. What it means is that you continually work on a respectful relationship so that if you do have concerns, you respectfully share those. But when you do see the team doing something that you really like, you also let them know that. And then I also think it's important parents know that you have every right to ask the special education teacher or other service providers how you can reinforce the skills and strategies being taught and used at school. This is something a lot of families are kind of shocked with, especially if they have very young kids and they're used to taking them to private services where the private OT or the private speech language therapist kind of debriefs them after the session to let them know what they did, what their homework is, that sort of thing. It's much more challenging to do that in a school setting because you are not having daily contact with these people. And so, ask, is there a way that we can communicate that's not overburdensome for the school professional, but allows you to know what they're working on so that you can continue to reinforce those things at home. And lastly, I have some resources for you guys. Here are pretty easy to access resources to IDEA in the California Education Code. The Autism Speaks Toolkits are a free resource that I cannot emphasize enough. They are not just for kids with autism, but there is a toolkit on how to sort of support almost anything you can imagine doing. There is one on IEPs. There can be one on considering medication, going to the dentist, taking your child on an airplane, just lots and lots of different sort of resource information about how to successfully sort of engage in activities. And then the Understood website, I think, is really great. It has a lot of information just about different learners. And then lastly, our website, the Center for Autism and Neurodevelopmental Disorders, where we have resources for families, but also, continuing education, parent workshops, things like that. And so this is where I say thank you for watching this video. Our Success in Education series has other parent workshops. And so if you have further questions, I think there's going to be information that follows me talking about how to access those. I hope you have a lovely day. Thank you. Bye-bye.